dear viewers, welcome to a new episode of Outpatient Clinic. My name is Dr. Imad Bashay. I started this channel for your educational purpose. Please do not forget to press subscribe to this channel and also hit this or smash the like button. This helps these videos to spread around. Diabetes mellitus. This is the topic about diabetes. So what is the definition of diabetes? Is hyperglycemia, elevated blood sugar. The plasma glucose casual is above than 200. The fasting blood sugar in the morning fasting above 126 is called diabetes. There's two types of diabetes. Type 1, insulin dependent, and this one occurs due to islet cells loss. The pancreas is not working. It's immune mediated or could be idiopathic. I've known some kids that got diabetes type 1 after coronavirus. Some got it for immune suppression, some got it with, we do not know the reason, we call it idiopathic. Usually occur in younger age, and these are prone to ketosis and common in young age, like 5, 6, 7, 12, 16-year-old, and become dependent on diabetes, or even 20-year-old from that age. Type 2 diabetes, they have insulin, but they got insulin resistance. They have relative insulin deficiency. The type 1 is complete insulin deficiency. They don't have insulin. These type 2, they have insulin, but not enough, and the insulin has a lot of resistance. This type also they have ketosis, can end up with diabetic ketoacidosis, although diabetic ketoacidosis occurs more in type 1. Most patients are usually overweight, and they have family history of diabetes. So it's very important to check your blood sugar, know the symptoms of diabetes, talk to your doctor about it early on, and know the treatment. How to diagnose diabetes? The good history, the nutritional status, you measure the weight, you ask them about the family history. Certainly if somebody obese and has a family of mom and dad has diabetes or brother diabetes, then they're more prone. You examine the patient, you check blood pressure, you check height and weight, you check the thyroid, you check the cardiac and lung exam, the dental exam, and you consent for fasting blood glucose or tell the patient to do it. And a test that I like a lot called hemoglobin A1C, it kind of gives you the average of blood sugar over the last 3 months. Some patients may fool the doctor, say, well, I'm always good, it's always 150, 140, I don't go up. But when you do the hemoglobin A1C, it kind of shows the whole average of 3 months. So that tells us a lot about the hemoglobin A1C. We check the BUN and creatinine in the blood, chemistries, and a lot of times we do urine protein, urine microalbumin to check if the kidney has been affected with diabetes. We give patient education in the management. We tell them stop smoking, stop alcohol, eat healthy, get away from a lot of fatty food, sugary food, anything white, lots of cake, cheesecake, pudding, rice pudding, all this, lots of soda with sugars. We don't like that. We ask them to do exercise, live healthy, at least try to walking every day, go to the gym, and self-monitoring blood sugar. I always tell people, try to check your blood sugar 3 times a day before meals, certainly fasting. Be careful about hypoglycemia when the other way around, the blood sugar goes down. Keep candy at a house or sweet stuff or sugary stuff or orange juice just in case you get irritability, tachycardia, heart is fast, you're sweating because your blood sugar is very low. The treatment group of family called sulfonylurea, they increase the secretion of insulin from pancreas and increase the number of receptors. The insulin and the receptor is like a key and lock. You need the proper lock and the proper key, and you need the insulin attached to the receptors and work together. You can give glyburide, glipizide, tolbutamide. We don't use this a whole lot now. The top ones we use, another one called Amaryl, I like a lot in elderly people, less hypoglycemia from it. Metformin is a very famous drug called glucophage, metformin. We start with 500 twice a day or 1,000 twice a day, and they have extended release. It increases the insulin sensitivity and decrease the liver production of glucose, and increase the glucose burning or utilization. So metformin is a very good drug. We start with it actually before the sulfonylurea. Another medicine called acarbose, it can be used, but we don't use it a whole lot. Coming to insulin, if I try everything and try the weight loss and try, especially in type 2, and none of these are working, sometimes I start insulin plus metformin. And insulin is different in type 2 than type 1. Type 1 from the get-go, from the start, I start insulin. So insulin is two types, Lantus or Glargine, or that kind of insulin is given once a day. There is another type called Toujeo. All of this long-acting. Your doctor will tell you the proper dosing, maybe 10 units, 8 units, 20, 30, 40. When you need a lot of Lantus, like 100 or 150 units, we tend to split them. We tell you, okay, take 60 in the morning and 60 at night. In cases of that severe hyperglycemia, severe blood sugar elevation, you need more insulin. That's a baseline. Long-acting insulin give you insulin to the body the whole time, over 24 hours. But there is short-acting insulin, something called Humalog or Lispro, you can take with meal. There is intermediate insulin, something called NPH. It has both. It has long-acting and short-acting. But I personally like the Lantus at night and Humalog or Lispro with every meal. Kind of giving me better control. Your doctor can use the NPH or intermediate insulin, and there's different types of insulin in the market. So this is the glucose. It needs to be metabolized. When you have diabetes, you tend to have blood sugar increase in the blood. The levels of the sugar increase. The liver is not acting well to metabolize the blood sugars. The muscles no longer respond to the insulin because the insulin receptors are not working fine. You have insulin resistance or you have deficiency of insulin. The pancreas is not secreting enough insulin or secreting no insulin whatsoever in type 1. This is the pancreas and this is the islet cells that we talked about. I'm going to show with the pointer. So these are the receptors, the key unlock. You need the glucose to be able to get to the cells, and this is the insulin receptor. They hook to each other. They get the insulin receptor, introduce the insulin inside the cell, and it will be able to metabolize and deal with the blood sugar. This is type 1 diabetes. As you can see, they don't have much insulin at all. This is type 2. They have insulin. This is the rhomboid shape are the receptors attached to the cells, but they don't secrete enough insulin and they have problem with these receptors or have increased insulin resistance. This type 1, you can see there is no much insulin coming at all and no insulin receptors. So this type 1 deficient completely of insulin. Type 2, they make some insulin, but they need to enhance this insulin or work on the receptors or decrease the insulin resistance for the blood sugar to be metabolized. This is the glucometer. Lots of you guys have that, and I tell people at least check 3 times a day before each meal, and certainly fasting in the morning. The complication of insulin, clinical impaction. Diabetes can affect the heart, cause coronary artery disease, because the endothelium of the coronary arteries become damaged. So you can increase heart attacks, increase 2 to 4 times mortality from heart attacks from diabetes. It can affect the kidneys and even cause kidney disease, chronic kidney disease, all the way to the dialysis. It can affect the eyes, cause retinopathy, and cause decreased vision or even blindness. It can affect the periphery, cause vascular disease, cause ischemia. It may end up having gangrene of the toes of your foot or end up, God forbid, amputation of the whole foot. So there is macrovascular complication and microvascular complication. The microvascular, neuropathy, retinopathy, nephropathy, all of these very important. Macrovascular, like the heart or ischemia of the vessels. This is the normal blood glucose. As you can tell here, the glucose is being dealt with. But here, there is high glucose, lots of glucose, and the level is very high. And with time, over time, you get disease to the blood vessels in your body. You end up getting heart attacks. You're getting hand to hand with high cholesterol. You're getting problems with your kidney. You're getting kidney failure. You're getting problems with your eye. You cannot see. You get retinopathy. You can get tingling and numbness from neuropathy. So a lot of complications. Save yourself troubles. Check your blood sugar. Go to your doctor. Look for symptoms such as thirsty all the time, drinking a lot of water, getting up from night to pee a lot, what we call glucosuria, like the patient is peeing a lot, and polydipsia, polyuria. Polydipsia means very thirsty. Polyuria means he goes to the bathroom a lot to urinate. All of this, and thirsty all the time, and fatigue and tiredness, these might be early symptoms of diabetes. I hope I shine a little bit about diabetes and the two types, type 1 diabetic, type 2 diabetic. Wishing you all health and happiness, and wait for me for the next episode of Outpatient Clinic and very important topics to come. Thank you very much for your time and kindness in watching this video till the end. Thank you.